Welcome to the Homegrown podcast, a place where we share the truth about food and farming from our kitchen to yours. I'm your host, Liz Haselmayer, along with my husband, Joey.
Good evening.
And together we hope to educate, inspire, and equip you in your pursuit of true nourishment. Today's guests are Dr. Zeneb Contractor, who specializes in neurology and functional medicine, and back for a second time on the show, Joey's wonderful mother, my mother-in-law, Theresa Haselmayer, who is a holistic practitioner. Welcome to the show, guys.
Well, thank you.
Thank you.
We are so happy to have you on today to talk about the singular topic of brain health, which I know has 1,000 other subcategories. And so we're going to get into that. But before we dive into the heat of the conversation, I want both of you individually to introduce yourselves and explain your line of work. So Zeneb, can we start with you?
Yeah, sure. So I'm a neurologist, headache specialist. And I dove into functional medicine because I always wanted to think outside the box because there was always something more that was missing in patients' needs in healthcare. And I started that journey in 2017. I have my own practice, Cincinnati Functional Neurology. And my other area of interest is ADHD and mood disorders, which I practice at the Affinity Center in Cincinnati.
Beautiful. That's wonderful. And Theresa?
Yes, I'm a registered nurse, and I worked in conventional medicine for like 30 years. And then my story led me to a chronic illness that no one could figure out. And long story short, I got better and went off to New York to study to become a holistic practitioner for Lyme disease and autoimmune and complex chronic illness, mystery illness, and started a practice here in Cincinnati called Foundations Wellness Coaching. However, we're now Foundations Wellness, now that we're adding a medical team to our practice. So
beautiful.
Very exciting, yeah.
Love that. Yeah, and if you want to hear Theresa's full story, we did an entire episode. That was a fan favorite, I have to say. So many people resonated with your story. So the thing I love about both of you guys is you both come from a conventional way of learning, and that's how you were taught, and then you kind of bridge the gap between conventional medicine and a more functional or holistic or integrative approach, which I think is important in any category. But with brain health, that can be a little more confusing to people. It's a little more nuanced. So I want to start the conversation by going over optimal brain health, and before we even get into daily practices, really explain to us how the brain develops and matures over time. I'm talking even like at the moment of conception or as far back as you want to go. I would love to hear just an overarching breakdown of what brain development looks like.
So from conception, I mean, till birth, I mean, even after, the brain is developing. So by the time the child is born, there are certain areas of the brain that have developed, and then they help develop other areas of the brain. So for example, child is born with sight and hearing and what we call the vestibular function, where it can help with coordination, which will help the child roll and sit and stand, which will then help other areas of the brain develop. And because when the child is born, there is a high, what we call sympathetic tone. So their heart rate is higher, their pupils are dilated, their digestive system is not optimal. That's why we don't feed the kids everything under the sun till they get to a certain age. So as the brain is developing, it helps to inhibit or reduce the activity of some of those areas which are in an overdrive. And then as those areas become more developed, then the child is able to do more and more growth happens. So when we talk about just brain development, we generally speak about the gray matter and the white matter. So gray matter is where you have all the neurons attached to it. And of course, there's more connections. And the white matter are the tracks. So planning, motor planning, executive functioning, all of this is the gray matter function. And then, of course, it defines and refines over a period of time with all the white matter tracks. So the gray matter is developing up until the age of 10. So we say we have this good opportunity for the brain to make a difference in kids' lives on providing them with optimal nutrition, exercise, good environment, having them stay away from toxins, for the brain to really help these areas develop. But there's also this opportunity for the white matter, which develops until the age of 20.
Wow.
So there are so many things that can impact brain function, but really it's not just about when the child is born. It also starts from what we call preconception. So maternal health is really important. And of course, what happens during pregnancy is also very important. What happens at the time of birth is important. And then the first 2 years of life is where there's a lot of growth happening in the brain. So the first 2 years of life are really important. So I would say that every stage is important. But as we get further along into, as the child is growing, we are losing a little bit of time. And that's why certain what we call childhood developmental disorders, which have a risk of development in certain stages. If we want to minimize the risk, we really want to focus on maternal health, even preconception. And certainly during the pregnancy stage and after the child is born, but there is opportunity to make a difference in certain conditions, like, for example, their learning disabilities or ADHD, where we can have a greater impact by really changing the environment of what the child is. When I say the environment, I'm talking about the environment in which the brain is thriving, whether it's related to nutrition, exercise, sleep, activities, chemical exposure, environmental toxins. That's where, Theresa's big interest is.
Yeah.
So there's when we talk about brain health, we have this broad spectrum of time frame in which we can make a difference as the growth and development is happening in the child.
Are there things specifically in pregnancy that women can do to optimize brain health? Is it mostly diet at that point? Like, what kinds of things are you looking at in that early stage of development?
So I would start with preconception. So I would look at maternal health. So for example, maternal weight, like obesity, is linked to having, is a risk factor basically for the childhood developmental disorders. And then of course there's a broad spectrum of the childhood developmental disorders, including autism spectrum disorder, learning disabilities, ADHD, OCD, so these to just name a few. So I would say from preconception, so maternal body weight is important. If the mother has any autoimmune conditions, that should be managed. Maternal hypothyroidism or hyperthyroidism, maternal risk factors like smoking, drug use. But during the conception period, of course, other things also become important. What's mother exposed to, for example, cigarette smoke or other chemicals, maternal infections become important, maternal antibiotic use or other medication use. So kind of the list kind of goes on. But at every stage, whether it's preconception, conception, and even after the child is born, one of the things that we really need to pay attention to is the environment. So what we eat, what we drink, and what we're inhaling becomes really important, but also what we should be keeping away from. And I think that all in all, whether you look at any stage of life, I think is really, really important.
I love that. What we eat, what we drink, and what we inhale.
Yeah.
So simple, right? So moving into sort of like daily practices that we can do for optimal brain health, or you could flip this and say things to not do, right? Things to avoid. Break down some ways that we can support optimal brain function in ourselves or in our children.
So most important thing that I start to work with is sleep. And I know I say it, I'm guilty myself, but we try to do the best that we can. But sleep is really important. Like, have you ever heard of, it happened to my kids. Like you wake up one morning and you go like, you grew, like all of a sudden. I'm sure some parents have had that experience. It's because sleep is really, really important for the kids. Optimal sleep is important. Maintaining a circadian rhythm, optimal bedtime routine, waking up routines, staying consistent with that is really important. Sleep has an anti-inflammatory effect, but also has an effect when we say we sleep, but really our body is really working efficiently and doing so many things at that point in time. So sleep would be one of the really most important things that I focus on or I start, because a rested child is always going to be a better child the next day. The second most important thing is nutrition. So, well, I can't say second most, but one of the most important things is nutrition.
Yeah.
Is because your child is developing, so they need the protein, they need the good carbs, they need the healthy fats. But really, what they also need is to keep away from foods that are going to promote inflammation. They keep away from foods that they may be sensitive to or allergic to. And a lot of times, it doesn't present with an allergy reaction. Because not all food reactions are allergy reactions. Sometimes they're food sensitivities, they're food intolerances, and they may be delayed. And they may not always present with a gastrointestinal symptom of a bloating or diarrhea or constipation, but they may be causing enough disturbance in their physiology that it may present with a tantrum or anxiety or depression, or I want to sleep more, or I can't sleep.
Yeah.
So identifying food sensitivities is really, really important. And as you know, that we are not eating the real foods these days because life is busy and it's more of a convenience, that these foods are either hybridized over a period of time or genetically modified, that we may not have the enzymes to digest all these foods. So that's one. And yeah, we are becoming more sensitive to things. So big foods like kids may be sensitive to wheat, gluten. They may be sensitive to milk, which has casein. They may be sensitive to albumin, which is in the eggs. Or they may be sensitive. Big sensitivities we see in kids is also to food additives and dyes, like the red, the blue, the yellow. And if you pick up food boxes, then you can see there's like these dyes in everything. And what happens is that these dyes actually bind to food proteins, and then your body just recognizes those as more like, aha, I can attack you, what we call antigenicity, and it creates an immune response to it. So it actually escalates the response, the allergic response to these food proteins otherwise. So I think the big thing is clean eating and keeping away from food additives and dyes and colors. And you can see, in our society, we easily distribute a lot of candies, and there's 1,000 ingredients, and the food things that are available for kids. And I understand there is a matter of convenience, but unfortunately, this does not help the brain. And so a big challenge is to really educate the parents to understand and to be on board, to be really able to make a change in their lifestyle, which could really help these kids. So with foods, of course, certainly is about eliminating what may be impacting their brain, but really also understanding what could really help to add to help the growth of the brain. So we need healthy fats, and a lot of, the fat-free diets have become a fad, and people don't understand the importance of fat. People don't understand fat. But really, if you can give your child healthy fats, like help them have fish. If they're not allergic to nuts, give them some nuts. And that could make a big difference. And if understanding that if your child is a picky eater, maybe supplementing sometimes can help. But really, you have to make a change as a family, because just asking your child to do certain things and you're not doing the same thing is probably not going to make a big difference in the development of the brain of this child.
Yeah, how often do you run into resistance from parents when you first tell them, hey, you're going to have to look at your food a little bit closer?
In my practice, I would say it takes me 3 to 4 sessions talking to parents. And I think by the time they get to the 4th one, because I think it's the anxiety about making a change. How am I going to make a change? And initially I would tell the parents, avoid these things. But then I realized that I'm not giving them what they need to know. Like, instead of this, eat this. And I think that has made a difference. But also, it's very individualized. So I have to figure out a child that may be sensitive to multiple foods and advise them accordingly, versus a child who may not have a lot of sensitivities. But I would say it takes 3 to 4 sessions before parents can become on board. Just cleaning the pantry can make a big difference. But also making them understand that these kids are very sensitive to fluctuations in blood sugars. So you want to make sure they're eating, But you also want to make sure they're not eating high sugar foods. You want to make sure that blood sugars are not going down, because every time the blood sugar goes down, the kids are not going to tell you, though, I'm hungry. They're just going to not feel good, have a tantrum, feel anxious, or feel like they can't focus or to concentrate. So whatever the symptoms are, they will get worse.
Yeah.
So avoiding the blood sugar spikes would be important, but also avoiding the low blood sugars will be really important. And then coming to the next thing, which is exercise. I think our kids are not very active. You know, we have the convenience of all the electronics, which is, yes, I'm guilty too. My kids used to, but you know, we have to make sure and educate parents that movement is really important. So one big part of brain development is that we get the sensory input from the gravity, from the stretching in our muscles, from movement in our joints, which helps really stimulate an area of the brain which we call the cerebellum, which does not get a lot of attention. But really, this part of the brain is forming so many connections in the brain that helps with motor activities, coordination. So kids really need to move. And studies have shown that even like 5 minutes of high intense activity or 30 minutes of regular activity can really stimulate different areas of the brain and can bring well-being to these kids. So parents should be definitely encouraged to have their kids move, exercise, structured activity, unstructured activity. Sometimes what parents don't realize is they need to get their kids involved in a variety of activities, so stimulating different areas of the brain. So yeah, they could be swimming, running, jumping, ping pong activity, but also involve them in other things like music, which can have a significant impact on their brain function. Classes like, you know, martial arts can have a significant impact. And then the other thing is social connections, you know, really connecting with whoever you can, whether it's your neighborhood kids, whether it's your family, it's your friends, but having some regularity in which your kids have exposure socially, where they are meeting, you know, just not their age kids, but people of different ages can have a significant impact on their development.
Yeah, I'm laughing because Joey just ran our 3-year-old for like a mile and a half, and exercise is a priority.
Twice. So we did 2 different runs. One where I took my poor 5-year-old nephew, and then my 3-year-old. And so my 3-year-old totally crushed it, and she has infinite energy.
Yes.
And my 5-year-old nephew did a great job as well. But
So Joey, what were you thinking then?
I was. So the way it went is my nephew was like, "Uncle Joey, can I go on a run with you?" And I saw it as an opportunity. I'm like, I'm gonna bury this kid in the pavement. Right? I'm just gonna take him down, and we're gonna take him to Suffertown and see how long he can last. And you know,
he's a very loving uncle. Just putting that out there.
I don't have any sons, so it seemed like an opportunity to just like, you're gonna be a man, right? And it was great, and I love him to death, and it was super fun. But about 0.2 miles in, he's like, Uncle Joey, I think I need a tissue. I need to stop doing this. And I was like, nope. And then like half a mile in, he started crying. And I said, you're good. He looked at me, he's like, okay. And got through a mile and a half, and he went inside, and he did tell his dad, though, I think that was a mistake. I don't think I should run with Uncle Joey anymore. But
you know what? His brain was developing.
Brain health.
You know,
Yes.
it was beneficial. That's great. I love that. I love those points. So exercise, food, sleep, so critical, right? And adults should take that into consideration too. Like, how often are adults like, oh, I'm just not doing well, but then they're staying up till midnight.
I had a question about sleep.
Right?
And adults, kids, however, so let's say you're in a season of time not getting optimal sleep, but you're getting naps. Is that equal? Or would you say that there's a difference between a night of sleep and either one versus naps kind of supplementing?
I think it's important to have a good circadian rhythm. So sleeping at night at a certain time and waking up at a certain time is really, really helpful because it really optimizes your cellular health. Nap, if it's a power nap, like 20 minutes, I think it's fine as long as it doesn't disrupt your nighttime sleep. What happens with the nap is if it starts disrupting your nighttime sleep, I couldn't fall asleep because I took a nap. And then it kind of moves into, I couldn't wake up in the morning. I didn't have a great day. I'm going to take a longer nap. And then that longer nap serves to push the bedtime even more. And then I think it becomes a vicious cycle. So I'm not saying I'm opposed to nap. If your body calls for it and you have the luxury for it, I wish I did. I would do it too. Yeah, a power nap is very different than actually a long nap, as long as it doesn't disrupt your nighttime sleep.
Okay.
That's good. I want to keep going into this optimal health because, Theresa, I know you have a lot to say on the environmental elements and things maybe that we should be avoiding for optimal brain or cognitive functioning. So talk us through some of your like heavy hitters, if you could just advise folks.
Yep.
What are some of the things?
Yep. I forgot to mention at the beginning that I have been training for over a year now with the Environmental Medicine Institute. Dr.
Awesome.
Lynn Patrick and Dr. Anne-Marie Fine, experts in environmental medicine for the last 20 years. So we have looked at volumes of research. In fact, our government has too. So there are several agencies in the U.S. government, the ATSDR, and there's a survey that the CDC also does called the NHANES study. And they have looked at ADHD and what environmental toxicants are most commonly playing in. So number one, according to our government, is pesticides.
Wow.
So not just organophosphate pesticides, which comprise over 50% of what is sprayed on corn, wheat, soy, many crops, and pyrethroids, which are sprayed in the houses when you're trying to kill roaches and bed bugs and so forth. But they were able to find in the research, so I put it in the show notes. You'll see in my document that the NHANES study, they studied 8 to 15-year-old children, and of those, 93% of the children's urine that were tested were positive for chlorpyrifos, which when you look at organophosphate pesticides, there's many of them. And there's a big difference between their toxicity levels. So some of them, chlorpyrifos is 6,000 times more toxic than something else. Unfortunately, when Joey was younger, and we had a garden and a corn stand with my father, I was spraying both malathion and diazinon in my garden, organophosphate pesticides, which are at the higher level of toxicity.
Wow.
I did not know any of this.
Yeah.
If I could go back in time, I would have not done that. I had an uncle who was a farmer, and he said, Theresa, if you want to keep the cucumber beetles off your melons, you got to spray them with diazinon, malathion, and 7, and you got to do it 3 times a week.
Wow.
And so I was spraying a lot out there. Didn't know. But the U.S. government does know that this is the top contributor to ADHD. And they have found that chlorpyrifos in particular has a high rate of association with ADHD, with lower IQ scores, and with autism spectrum disorders. So the Obama administration did ban it. I'm not a big political animal, so don't hear this in me. But then another administration reversed the ban, and then it was banned again under the current administration. But I was researching the other day, and this Ohio Journal of Farming was excitedly announcing that they took the EPA to court and sued them and brought chlorpyrifos back.
Wow.
And I was just heartbroken. And I knew all the environmental medicine people, because this is the one that we've got to get out of our food supply, because this one alone is creating these brain neurological disorders. Not only that, but we know from the research also that they play into food sensitivities. Why are we having so many kids allergic to or sensitive to gluten and dairy and all of these nutrients that nature made for them? And the answer to that is what these organophosphate pesticides and pyrethroids, multiple classifications of pesticides, what they do to the gut microbiome. They kill off good bacteria so that not so good bacteria, the bacteria that weren't really doing any harm, like strep, that's normal, yeast, that's normal, Clostridia, that's normal. But when the pesticides and Roundup kill the good bacteria, then it can create this overgrowth of something like strep, which will cause these high anxiety disorders. Not to mention Clostridia and yeast. So the pesticides were number one.
Wow.
And our government knows this. And what kills me when you look at these agencies online, their stated mission is to protect the public from, you know, environmental hazards. And I'm thinking, you know this, it's in your research, but no one's being educated. People, I mean, do you ever hear about this?
No, never. Mm-mm.
And so we know that the number one source of organophosphate pesticides is food.
Wow.
It's also in water because of runoff. You know, if you have sprayed billions of tons of these chemicals into the fields, it's going to saturate the soil. As it's going to, when the rain comes down, it's going to pool in water into streams, into our waterways. And, you know, our municipal water facility treatment plants are not getting these things out. So parents need to 100% filter their water.
Mm-hmm.
And I know that's something that you teach too, Dr. Contractor, and organic food. I mean, this is a big hot button discussion. I know you guys have talked about it a lot in your podcasts.
Mm-hmm.
And people, I can't afford that, Theresa. But the research shows even those who will eat 30% organic, just 30%, make a difference in their fertility, their ability to conceive.
Wow.
Their ability to carry a pregnancy.
Mm-hmm.
And so these pesticides have been implicated in many things, not just ADHD. We're talking about brain health, but they've been implicated in many things.
Mm-hmm.
So that would be number one.
Pesticides.
But there's more. I mean, flame retardants are number two. And flame retardants, you pick up from couches and carpets and clothing. And people don't realize that when you bring home a new piece of clothing from the store, it's going to be saturated in flame retardants.
Is it the PFAS in the flame retardant that are the issue?
There's actually organophosphate pesticides in the flame retardants,
Okay.
but it's the flame retardants themselves. It's a different chemical than
Okay.
PFAS.
Okay.
But there are PFAS in some clothing as well. And these things can enter the body transdermally. But more than that, what we're finding in the research is it's getting into dust. So when these chemicals are flaking off that couch, off the carpet, off of the clothing, the drapes, anything that's been sprayed in a flame retardant, it is getting into the dust. And so there have been whole meta-analyses of dozens and dozens of research papers, peer-reviewed research papers around this. And in the U.S. household dust, number one was phthalates, which we won't go there, but number two was flame retardants. So
Really?
flame retardants, you could literally just be, so when Dr. Contractor said what you're breathing in, what you're inhaling, cigarettes is one thing, it's the air in homes. Indoor air quality is considered 3 times more toxic than outdoor because of phthalates and flame retardants actually in the dust in the home. So children and families are inhaling it. They're also playing on the ground. They're getting these flame retardants and, phthalates on their hands. They're putting toys in their mouth, so they're ingesting it and they're inhaling it. But in truth, the most toxic chemicals to us are the ones we inhale because there's just no barrier at all. When you take it in through the skin or the gut, there's some level of barrier, but when you inhale it, it goes right into the bloodstream. There's just no filtration through the lungs. So these things can easily get into cells, and they can easily embed themselves in that matrix, that extracellular matrix, all the goo between the cells, and can cause those leaky gut syndromes, can cause many of our modern day autoimmune and chronic illnesses and food reactions and so forth. But I digress. Number 3 on the list is metals, lead in particular, but also mercury and cadmium. And those have been studied the longest. There's the greatest body of research around those. I'm going to tell on Joey. When he was younger and he was having so much trouble in school, I had been seeing a doctor for my own illness, and he found I was very high in lead and mercury. And I'm like, I wonder if that could be impacting Joey. And Jerry agreed. We had him tested. His lead and mercury were higher than mine.
Wow.
He didn't have the dental amalgams like I did. He didn't have the exposures to leaded gasoline in the 1970s like I would have as a kid, or in leaded paint. We know, again, from the research that these things are passing mother to baby. They're passing in utero. And so when Dr. Contractor was talking about preconception, I mean, I am all over that too. I am very passionate, and my teachers very passionate about preconception care. So if a parent wants to really give their baby a head start in life, any type of detoxification, I mean, I had no idea I was passing lead and mercury to Joey.
Yeah.
I'm sure my other 2 children have it too. We just didn't test them.
Mm-hmm.
But they've had their issues too. And so that's the 3rd category. I know I'm going all over the place.
No,
but
that's great.
To answer your question for ADHD, number 1, pesticides. Number 2, flame retardants. Number 3, metals. Those were considered number 1 for a long time. But our exposures to them have decreased somewhat. And what's increasing are the exposures to pesticides and flame retardants. And then number 4 I wanted to mention, which is near and dear to Dr. Contractor's heart and mine, are the screens, electronic screen syndrome. That's a whole category in and of itself. And I encourage parents in my office to get Dr. Victoria Dunkley's book, Reset Your Child's Brain in 3 weeks. She asserts, she's a pediatric psychologist. Her book is a New York Times bestseller. She asserts that if screens are eliminated for 3 weeks, that she can get 80% of her patients off of their ADHD medications.
Wow.
And, it's because of what the high resolution graphics, which are not natural light, when those enter the eyes, they affect brain chemicals. Your dopamine, your acetylcholine. And so I'm sure Dr. Contractor knows more about that than me. But, when those brain chemicals are dysregulated, it can create sort of an addict sort of a mentality, like there's so much dopamine flowing to the brain. They get desensitized to it. They need more and more and more. And their melatonin is dysregulated. They don't sleep as well. They crave sugars. And it's a huge problem. But those are the top 4. To answer your question.
I think let the record show that all of my school challenges and behavioral issues were the metal. I think that's kind of what we decided here just now.
And probably the pesticides, because Joey was working out in that garden picking.
Poor boy.
It was a hard life. And
I forced you to pick weeds out in that garden. I forced him to pick the garden. So he would have had a lot of exposures to those organophosphate pesticides as well.
This is explaining a lot.
And man, I have made it so far under all those circumstances.
And more than likely, you genetically, there's a certain gene, the PON1 gene, a genetic mutation. If you have that, you do not detoxify pesticides as well. So it can get into a vicious circle. There are whole papers out there on what organophosphate pesticides do to the DNA. They actually damage it so that you can't detox pesticides well.
Wow.
So when children are exposed in utero to these organophosphate pesticides, it will actually set them up to not be able to detoxify the pesticides when they get exposures when they're eating their rice cereal or their non-organic food. And that's why these childhood illnesses are exploding in this generation. It's all the things. It's mom passing it down to the kids. It's prenatal exposures to these things, the metals, the pesticides, the flame retardants, and more. It's really kind of a miracle that we're doing as well as we are. But, you know, I think we were created to be very resilient, and there's lots of things we can do about that. But yeah, there's a lot contributing to these issues. Yeah.
Yeah, and then you combine that with poor maternal health, poor diet, lack of exercise, disrupted circadian rhythms, sleep cycles, increased stress.
Yes.
I think we talk about a concept of like critical load, right? So there's only so much your body can take. We definitely have more resiliency when we are younger, but as we grow older, there's only so much we can take. So once you hit that critical load, that's when your physiology gets more disruptive, and you start having symptoms, and you start having problems because that either organ or system is not functioning optimally. And even before it becomes a disease, you're having all these symptoms that what I like about functional medicine is we're looking at function of systems and organs even before it becomes a disease.
Yes.
So as Theresa mentioned, there's just so much more in our environment, from everything we inhale, anything that we drink, eat, that has a significant impact. And yeah, you're right. I mean, some of us are not good detoxers, and unfortunately, we can reach a critical load much faster, and succumb to symptoms and then disease.
I want to circle back to this screen conversation because I think this is so prevalent. I've read part of that book, if that's the same book you gave me like 2 or 3 years ago. And we're in the midst of a bit of a screen detox with our kids because we were just like, you know what, you're not sleeping super well, and screen time is really just a privilege. It's not like you're entitled to it as a child. So we're just done with the TV. I unplugged the Wi-Fi during the day, like we're done. We're done with it. And surprisingly, I didn't get a whole lot of pushback. But I know that is something that's hard when you look at a parent and you say, listen, that iPad, it's got to go. But if you could explain to us what is happening in the brain when kids are exposed to these screens and these artificial lights and the stimulation, like Theresa was saying, what's really going on there?
I think there's multiple things going on. One of the things is instant gratification of something happening. So there's this dopamine release, right? And who wouldn't like it? Right?
Yeah.
And then you kind of get used to it, and you're constantly looking for that instant gratification. And if you have a predisposition to a condition like, for example, ADHD, and you're looking for that instant gratification, it just becomes easy to get from the screen. But there's also this electromagnetic field, right? That is disruptive. It causes inflammation in the brain. It disrupts your, like Theresa was explaining, your melatonin release. So your sleep cycle gets disrupted because if the melatonin is not released, melatonin is typically released an hour or two after the sundown. So, you can go to bed by 8, 9 o'clock at night. But if you have the screen time, just the light, constant light, it will not allow your gland in the brain to release the melatonin. So, of course, the sleep cycle becomes disrupted. So I don't think it's like one thing. It's a web of complex things, and you get into a vicious cycle. And yeah, it can become addictive because of the dopamine and, the instant gratification that the kids are getting. But also that their mind is like constantly working. So they get no downtime, no time to relax and rest. So there's, at so many levels, these screens are having issues, and maybe Theresa can add some more to it.
Yeah. Theresa, any thoughts?
Well, yeah, the EMF too. Like you said, is what it does to the calcium channels in your body. It just floods, it opens the, those voltage gated channels and allows calcium to just flood into your cells. And so you get oxidative stress. So anytime you have oxidative stress, it might not directly cause inflammation, but it can sure add to it. So the EMF is a problem. The screens, so like a computer screen will have a bit of flicker. So flicker is disruptive to brain chemicals, but the high resolution graphics and the gaming is the biggest thing, is what Dr. Victoria Dunkley tells us, that it can be puppies and kitties. It can be ABCs. It doesn't have to be violent content. It's the actual high resolution graphics, and they're getting more and more high resolution all the time, because gamers, of course, want you to
experience that awesome
yes
visual effect.
Yes.
Joey was also a gamer as a child, I just have to say.
Yes.
Add it to the list.
Add to the list. So it was, they're very disruptive to just those neurotransmitters. And
so is the flicker something that is less so you were comparing like a high resolution to a non-high resolution. Is one less impactful?
The flicker is less.
Oh, okay.
So you can get computer screens that are low flicker, but the high resolution graphics on the smartphones and the iPads are the worst.
Really?
Those are the absolute worst.
Okay. Because there's no interruption. There's no
It's the unnatural light. It's what the unnatural light does to when it's received by your eyes, and then it affects the brain itself.
Now, is that something that can be filtered, or is it because it's high resolution, it's always going to have an impact?
Blue light can be filtered.
Okay.
But the high resolution graphics, my understanding is it cannot.
Okay.
And the flicker cannot.
Okay.
That's a great question, because we could be, putting on these blue light blockers and like, oh, we're fine, we're good to go. But there's another layer there that we're still being exposed to that might be affecting our circadian rhythm, right? Or might be affecting our cognitive function or our kids, and we don't even know it.
I mean, anxiety and depression have been directly linked also to the effect of the gaming.
And so when you say gaming, you mean that high resolution, or do you mean like the stimulation of gaming itself?
Interaction. Anytime you've got interaction.
Got it. Okay.
So when there's interaction and there's just a lot of focus on that, that causes the highest level, is what she tells us in the book. I'm not an expert, but this is what I've read in the book.
No, that's helpful.
That the high resolution graphics will create the inflammation in the brain. And so she says it takes 3 weeks to reduce that inflammation.
Wow.
Week 1, when parents take these screens away, she said often their symptoms will get worse, because they will go into sort of this withdrawal and they'll start begging and crying. So parents really have to be aligned on this. But by week 2, they'll start doing better. Parents will start seeing some improvements, less anxiety, better social skills at school, completing schoolwork better, and better social skills, less begging for sugar, and better sleep. And by week 3, typically they're wanting to play board games and go outside and read books, and a lot of that inflammation goes down. And she said some kids can be reintroduced to it at more limited levels and not get back to that inflammation level again. Others, even just a half hour gets them back in a bad place. So that's where that really depends on what other chemicals are on board. Is that child filled with lead and mercury?
Right.
Is that child filled with mold? Mycotoxins? Is that child filled with organophosphate pesticides or flame retardants? It's very individualized based on, toxic load.
And that brings me to my next question, which might not be answerable, but like if we're talking about root causes of some of these disorders, if we're talking about ADHD or ADD or anxiety or depression, are there things where we can pinpoint a root cause, or is it more of a collective effect of the things you both just discussed?
I think we call it like, there's so many different factors and it's so individualized. But when we talk in general, it could be any one of these or a combination of these, one more than the other. So as I said, everything starts from preconception. So we generally don't talk about that. We only talk about maternal health. We don't talk a lot about what happens at birth, which is very critical.
Talk to me about that. What do you mean by that?
So at birth, it's like a full term versus a preterm delivery. We talk about cesarean section versus normal delivery. That kind of a big impact on the child.
How does that impact the brain?
The brain and the general health. So the microbiome, it really impacts the microbiome when child goes through a natural birthing process versus a C-section. We don't talk a lot about what was the child fed. So in terms of nursing, from mother's milk versus bottle fed, because there's so many advantages of the child being breastfed for an extended period of time, a year or a year and a half or 2 years. But even if it's for 6 months, it can have a significant impact on the brain development, because they're getting the good fats, they're getting the healthy microbiome, the immunity from the mother. Because as I mentioned, the child's gut is not fully developed initially, and as the brain develops and the gut develops and they're able to eat more of the foods. And then the risk factors, like what is the mother eating at that point where she's nursing the child? What is mother breathing? And what is the child exposed to in the home environment in terms of the air they're breathing? And then, of course, things like sleep, as we talked about, and how much stimulation the child is getting. Just holding your child can really stimulate the child. Rocking your child back and forth can really stimulate the child, swinging them side to side. What do you have at home that's stimulating the child? All these things can make a significant impact on a child's development. And when it comes to feeding the child, then what are you feeding your child, right? And that's where Theresa said is like, even if you can be 30% organic, it can have a significant impact on the reduction of their pesticide exposure. And I think that can have a significant impact. But then are you feeding, making sure your child is getting things that would help their microbiome to grow? Like, are they getting vegetables in their diet? Are they getting healthy fats in their diet? Are you keeping away from processed foods? Are you keeping away from artificial sweeteners, flavors, additives? So I think all of these can have a significant impact. So even if you have a genetic predisposition, and I used to believe that if I'm genetically predisposed, I'm going to get something. Until I dove into this functional medicine, thinking outside the box, and I understood that, yeah, genetics play a role, but environment plays so much of a bigger role. And your social connections also play a big role in your development and your avoidance of actually having an expression of a gene. So I think all of these things are really important. And I think as a society, all we're doing is working hard and trying to, what we think we are, providing for our family, but I think we are really taking a lot away from our family. So ordering fast foods or foods on the go, just because both parents are working, don't have the time, not having downtime with their kids or playing with their kids, I think is all impacting the growth of our children, which now, unfortunately, with the advent of all the electronics, it's just getting easier for parents to say, you play while I cook, or you play while I run for the grocery, or you play while I order the food. And that's not helping either. So I think we all have to make an effort as a family to say, hey, when you wake up in the morning, I want you to move, eat this healthy breakfast, try again, because I just don't think there's a point where you should give up as a parent, because kids are dynamic, right? They're growing up, their needs are changing, but you just keep trying, and it will happen. It has happened, and it will happen. As providers, we encourage the patients and parents to say, don't give up, just keep doing it. It's okay. So I think one of the things that we lack is also the support system. So when children get diagnosed with a learning disability or ADHD or ASD, they're going in therapy, but parents are not getting a lot of support. So one of the things that we should do is have groups for parents to support each other. We should have parents who have they could be going for therapy as a family, or as the couples could be going for therapy, or parents could be going for therapy for their children, so that they know how to handle these things and not get disappointed. So I think in managing brain health and managing any of the childhood developmental disorders, it is important that both parents are supported while they can support their children, because it's a journey and it's very dynamic. The needs are changing constantly. So it's a process. It's challenging. I would say it's very challenging. But I think a lot can be done, because as I talked about the window, of brain development, and we want to do as much as possible during that period of time.
Something I have seen pushback on, and I'm curious your thoughts are, when children have developmental or neurological disorder, there's a real pushback on feeding them specific types of foods, because they'll say, no, they need the consistency. They need that packaged food because that's the only thing they'll eat, because they're craving that consistent texture. It's not like a bite of fruit where maybe one moment it's sour, one moment it's sweet. And so a lot of these parents, I feel like they are trapped into a system where they have to reach for the foods that their kids will eat, because they're in such a sticky situation. How do you encourage parents out of limiting themselves and their parenting methodology around these processed foods? Have you heard this pushback too, of like, my kid won't eat that, so I'm just going to feed them whatever they will eat?
You will hear that, yes. And I think we just need to support the parents. I think they're all trying to do a good job.
Yeah.
But we just have to try, and we have to try every which way. Because some of these kids may have what we call sensory processing disorders. So yeah, they may be just used to a certain touch of a certain clothing or texture of a food, and they may not want to do the other thing. But if they can understand that brain requires other things to develop, this may be one of their bigger issues, yes. But if you can move your child, if your child can sleep, if your child can find nourishments in some different ways, if your child is not addicted, or spending too much time on the screen, you can really help the development of the brain, which is helping develop a lot of what's going on in the body as well. So I wouldn't just give up on it. I would encourage them to continue. As I said, it's a journey and it's very dynamic. It changes. As you know, you have kids, right? So their needs changes, their wants changes, and what we need to provide them and changes over a period of time. And as I tell my patients, it's like, just when I thought I knew it all and I got it, my child started doing something else, you know? So it's a process. I think we just need to be supportive of the parents who are trying, but I would keep trying, keep doing it. As long as the child is not allergic to it or sensitive to it, I would try to give them something else, and then hopefully they would ultimately pick it up, eat it, and say, this is safe, and I can eat it without any problems.
My thought would be that they have to become accustomed to that processed food anyway, right? And so if we could steer away from that on the front end, but I guess the thought here is that, hey, we used this and now I'm being told this information, so the transition is going to be that much harder. That's kind of what I'm hearing there. Yeah,
it's kind of a sticky situation, because how many parenting decisions do you make in the beginning when you're like, oh, I just didn't have the information? I mean, you just talked about that just now, and I feel like there's so many things that would make different. I would have a different conclusion on with my first child than with my third, so.
But this is the message I have for anyone and any parent in any stage of their life even. It's like, it's never too late.
Yeah.
It's never too late. If you have the knowledge today and you want to start now, I think you can. And you did what you did, but having that information, move ahead, because there's so many things that we can still do.
Yeah, that brings me to, I want to talk about from both of your perspectives, what are some of the major levers you guys can pull or help parents pull in terms of treatment or improvement in, not even just for parents, for anyone with thinking about optimal brain health or whatever challenges they might be overcoming, but some of the levers we can pull, maybe echoing what we've already talked about, maybe sharing something new. How are you helping people navigate various brain health and functionality?
Well, information is power. Mm-hmm. So one of the things that we have started doing is ordering these functional labs for children when they come in. Jen and Lisa, my practitioners extraordinaire, see a lot of these kids, and when they come to them to see them for their anxiety or their Lyme disease or their sleep issues or their food sensitivities, whatever it would be, they'll order some urine panels and look, what are we up against here? We can guess, but what if we actually look and we see that they're off the chart in glyphosate, they're off the chart in BPA, or they're off the chart in lead. Mm-hmm. I can tell you that in the adult population, over 45, 50, a lot more lead and mercury, whereas the younger ones, Jen, Lisa, are seeing high BPA and high Roundup in every single one.
Wow.
Lots of plastics, lots of Roundup, and those organophosphate pesticides in some, not all, but it can be really helpful to know, because some research, that is, there's not nearly as much research on the plastics, that's still kind of new, but there's some research, and I included it in the handout, on plastics and phthalates also playing in. So identification of what you're up against, because once you identify that, then you can sit down with the parent and you can say, okay, your child is off the chart on BPA, so let's look at your daily lifestyle. Are you drinking out of plastic water bottles? Are you using a plastic cutting board? Are you using plastic coated dental floss and toothbrushes? Are you storing your food in plastic containers and Ziploc bags? Are you microwaving your food in plastic? Are you ordering fast food all the time where it's coming in these containers with PFAS and plastic? So we check for PFAS too. So if those are high, we can just whatever it is. Mm-hmm. And then, so number one is always stop the exposure. We've got to stop the exposures. Step two, let's get some good high quality binders on board that are targeted to whatever it is that you tested for. And then we like ion cleanse detox foot baths. Children, not so much saunas. Adults can do that. So avoidance is key, and as much organic as they can afford, and filtered water, huge sources of these chemicals.
Mm-hmm.
Wow. That's huge.
Yeah, what would you say are some of your levers that you're helping parents pull in terms of optimizing their kids' brain health?
So usually when I see patients, I don't see a lot of kids, I see adolescents and adults, but really starting with the lifestyle, clean eating, exercise, things like making sure the digestive system is working, they're pooping every day, they're sweating. Huge. Yeah, exactly. So like really making sure that physiologically they are doing the things that will help their body to get rid of things. Mm-hmm. And as I tell them, it's like peeling the layers, right? Mm-hmm. So I want your physiology to be optimized. Sleep is a big part of it too. Again, we talk about EMF exposure, we talk about downtime, we talk about meditation, relaxation. So I usually talk to them about like 5 pillars, no matter what disease or condition or symptom I'm treating. It's nutrition, food, exercise, meditation, relaxation, sleep, and hydration. And you'd be surprised that a lot of people don't drink enough water. They are over caffeinated because everyone's in a survival mode. Everyone's in the high functioning fight, fright, fear response. So just working on those things can really have an impact And then depending how much of an impact they have, then we say, okay, what's the next level that we need to peel? So always take a history of their birth, the environment they grew up in, psychosocial factors. If they need to work with a therapist, yes, they work with a therapist. If they have exposures, and we talk about exposures, if they need testing for specific toxins, I usually refer to Theresa, or do the tox panel in the office, and then figure out from there. So really, if you work on your physiology, you can overcome you can really help your body to work optimally, and overcome a lot of these things. But as we talked, that some people are not good detoxers, right? So they may have a critical load that exceeds the limit the body can handle, and then that's when they just can only get that far. And if you can only get that far and then you plateau, then you know that something else is going on and you start looking at other things. So I work on, of course, optimizing their digestion. If they have digestive issues, then the question always comes, why?
Yeah.
So just like Theresa was explaining, that if they have chemical exposure, toxin overload, it can really impact their digestive function. Everything from, as we call, north to south, from, their stomach acid to enzymes that are released by the pancreas or your gallbladder functioning, which could result in slowing the motility of the gut, which could result in things like constipation, which will result in, your microbiome or your healthy bacteria being disturbed. It will cause inflammation, cause leaky gut, and then that can cause other issues.
Right.
The other thing we definitely focus on is comorbid conditions. Like we know that nothing happens like as one thing. So it could be anxiety, it could be depression, it could be muscle pain, fibromyalgia, it could be musculoskeletal issues. So I work pretty closely with other multidisciplinary, professionals, from chiropractic doctors to nutritionist, to massage therapist, physical therapist, occupational therapist, so that the patient can have more of a holistic care. And I definitely encourage my patients to get into meditation, relaxation, journaling, gratitude, which is a big part of, your mindset is really, really important. I have personally benefited from, and I encourage my patients to exercise first thing in the morning, if yoga is possible, or whatever they like to do, but just starting their day right can really set the stage of having a really good day.
That's awesome. I noticed neither of you, and understandably so, haven't even mentioned pharmaceuticals, right? But when you go the traditional route of your child has ADHD, what's the first thing that you are often prescribed is a pharmaceutical, a medication. So in your opinions, where do those fit into the treatment, and are those necessary to the healing, or are they one path and yours is another?
So at least in my practice, I wouldn't say it's one path or the other. I think we try to assess if this particular child, adolescent, or adult would benefit from a medication. And sometimes the medication could be a bridge to getting you on the other side, because your symptoms, because for ADHD or for any of, condition, there is this big spectrum of where the person is, depending on how disabling your symptoms are. Are you failing in school? Are you failing at work? Are you failing in your relationships? And so I'm not going to withhold the treatment, but it's like something you discuss with the patient or the parents and say, this could be the benefits of it, this could be the side effects of it. We can start and see how well they do. Fortunately, there are options, pharmaceutical options, that are stimulant medications and non-stimulant medications. So that's kind of nice that we have a variety of medications that are available. There are some common side effects, like appetite suppression, could cause some nausea or headaches, increased sweating, for example, dry mouth. So we have to be cautious about when we're prescribing it. But under good supervision, these medications can have a very positive impact. So I have seen life changed for a lot of patients when they went on medication. But I've also seen a lot of lives changed even better when they have combined a holistic approach with medication. So I always tell patients, medication will have a limited benefit, but you have to bring your physiology in balance. And if we can do both, you can have even better results, and you would never feel dependent on a medication, because on a daily basis, your brain will know how to get stimulated and feel better, because with exercise, for example, you will be able to help your brain to release the dopamine it needs, form the connections to release. It's not just about the dopamine release, it's also all the growth factors that are released, improved oxygenation to the brain, improved nutrients that go to the brain, can have a significant impact. So the holistic approach with the medications can be beneficial for a lot of patients. And I think just medication alone is helpful, but I think it at some point, it maximizes the benefit. And patients are like, I was good. I was doing really well initially, but I feel like the effect is not as great as it was. And then you sit down and you listen to the patient, and they're just not sleeping, or they're not hydrating, or they're not exercising. And then you start working with those things, and things get better.
Have you ever heard the phrase, don't major in the minors?
No.
It's this idea of like, don't try to obsess over, what's a good example? Don't try to obsess over eating your oranges for your vitamin C every day if you haven't even thought about how much protein you're getting, right? Or like, don't try to obsess about maybe getting I'm blanking on the examples, but it's like, if you are not doing the things that you're talking about, right? Sleeping, proper nutrition, limiting your exposure to environmental toxins, thinking about your stimulation through screens and technology and media and social interactions, which tie into that, then yeah, you're gonna feel bad.
Right.
And you might be so distracted by this shiny object over here, right? That maybe you saw online is like this new drink or beverage or whatever. Don't major in the minors. I think that is such a simplistic way. Obviously, that's not going to help anyone just with that blanket statement, but it's just a good reminder. I hear both of you echoing this. It really comes back to these basics. It comes back to our physiology. It comes back to restoring the way we were created, and getting there might look like leaning on medications for a time, and that's okay. Getting there might look like, hey, we got to test first and see what our toxic burden even looks like, so that we know what to target. And I think that both of your messages are just really hope-filled. They're incredibly nuanced and incredibly individualized, but I have heard you both kind of echo really amazing ways that I feel like anyone can take and turn into action. So I think that's really cool.
I think I'd love to even just talk about some of the things that I saw around when I was diagnosed with ADHD, I believe. At least I think I was. And first went to like the, schooling class club where you would learn how to see school differently in the learning center, whatever it's called. And then it was, what did we do next? Was it did I go on to Adderall after that?
I think didn't I take you to Dr. Jim? And
we did that eventually, but I
detoxed you.
I remember growing up, ADHD became so prevalent, it felt like out of nowhere. Kids were walking around with Adderall and Ritalin like cans of Altoids. It was like everywhere. Mm-hmm. And then it became like, there was like a black market and people were selling it. It was like a whole thing. So, the next thing we did was Dr. Jim, and that was chelation.
Yeah, you did some chelation, and we did bring your mercury and lead down. But
are these still common practices? I guess was the question. The chelation.
Oh, very uncommon.
Really?
I don't think most people are aware of these things at all. That's why we're so passionate about it at Foundations. Yeah.
So chelation is a thing today.
Yeah.
Still, that would be.
Not many places do it. And we don't do pharmaceutical chelation. We do more natural chelation. But
got it.
And there's nutraceuticals too that can be helpful. Different supplements that can be really helpful for brain health as well, that we'll tend to use. And elimination of the screens. That's the one I usually get a blank stare from the parents. It's like, what do you mean? Because they're addicted to their screens too.
Right.
So it's really difficult for them to think about taking their child's screens away when they're addicted themselves. It's a huge thing. And
but that's about education, right?
Education.
So,
that's why we're here.
Yeah,
Yes.
that's why we're here, and that's why I hope your podcast, is famous because of a reason. Like, people can get good information from here. It's not easy. It's not easy working with parents and having them understand certain things because, they need to know to understand so that they can make a change. But hopefully, as a society, we are beginning to see a change because there will be patients coming to me now and saying, I don't want medication. I want to try everything else that I can do to make a difference. And that's really nice to hear that people are coming, asking for it rather than me offering that this is what we can do for you. So, I think you guys are doing a wonderful job of getting the word out there.
I agree.
Thanks. That's the whole goal. Any final thoughts from either of you before we tell people where they can find you?
I wanted to mention that if a case gets rather severe, that it is important that infectious organisms are looked at. So that's kind of where something that we do at Foundations as well. If there's any chance there's Lyme disease or co-infections of Lyme, we want to test for that. We want to look for that. I can't wait to announce our new nurse practitioner who's going to be doing some of higher level testing for us and pharmaceuticals that are safe and helpful. But we make a formula called liposomal essential oils, which are very cutting edge. For these infectious organisms, not just Lyme, but parasites, yeast, candida, fungal organisms that can overgrow as a result of pesticides and Roundup and plastics, what they do. So getting the right good bacteria, we always encourage eating probiotic jar ferments or just some type of ferments if they can handle the histamines. Raw milk, kefir, we love to advocate for that. To get the good bacteria back in will help defeat the bad. And our liposomal essential oil formulas we customize and we make at Foundations, and anyone who works with us will get one of those, but we'll use other formulas too. That can be very beneficial in getting strep or Clostridia or something, yeast, under control, which affect the brain. So it can be a two-part thing. The toxins and the infections can both impact the brain. So I think that's maybe one last comment I wanted to throw in there.
Yeah, that's really helpful.
Some people need that. They need that extra layer.
Yeah,
added into their care.
Makes sense. Yeah.
So the things we talked about, brain health, they're just not limited to children or the developing brain. These are for adults and in all stages of their life. So if you can just work on these basic principles that we talked about with nutrition, healthy eating, organic eating if possible, reducing your toxin exposure, healthy, clean water, exercise, like I said, at least, exercising first thing in the morning if you can, meditation, relaxation, sleep, you can have a significant impact on preventing several neurological and non-neurological conditions. And I have also seen patients who have presented to me with various other conditions like brain fog. I'm in my 40s or 50s and can't think, kind of thing. It can have a significant impact on them. Even with my patients with memory problems in their 70s have benefited from just these lifestyle changes. So I think these are across all stages of life. And then, yes, if your symptoms are still persistent beyond that, then definitely get testing done to figure out what's going on. Sometimes it's some things like nutritional deficiencies, or it could be a thyroid problem, simple, but it could be something more that needs to be looked into, like a neurodegenerative process. But the great thing is that we as individuals have the ability to do a lot to prevent diseases. before they even begin. Because, like as you say, dis-ease is a uncomfortable feeling somewhere in your organ or physiology going on. So if your body is telling you something, if you're having a symptom, listen to it. So you do something about it. Start with the basics. If it still persists, there are practitioners in the community. There are out there to help you. And as Theresa and I talk about, we have only one brain, right? Brain doesn't regenerate. So if you're having brain-related symptoms, certainly do not waste time. Get onto it. And then if it's beyond just the basics, then certainly reach out to a professional who can help you with it.
That's good. Yeah. Do we have any questions that we needed to cover? Oh, you're not going to read it?
In case there's a word that I can't read, I figured I would give it to somebody really.
Are there connections between mold and ADHD?
100%.
Can you expand on that?
Mycotoxins that are released by molds to defend themselves are very, very, very inflammatory. They're lipophilic, which means that they gravitate to fat. The brain is a very fatty organ.
Yeah.
And so ADHD, but more than likely OCD. OCD and bipolar and brain fog, depression, anxiety, all can come from mycotoxins. Yes.
Wow. Next question. What causes brain fog?
Brain fog. Well, I think if there's any form of inflammation in the brain, it can cause difficulty, remembering things, word recall, or just general cognition. Mold can do it. That's a big root cause. Lyme disease can do it. And just environmental toxicity in general. There's a lot of things that can cause brain fog. So identification of it is important.
So whenever patients say brain fog, I can't think, I forget a word, but it comes back to me. Like, of course, you want to make sure that it's not a serious condition going on.
Sure.
But just general brain fog, I can't think, can't focus sometimes, but no history of ADHD kind of thing. You'd look at their diet, nutrition, lifestyle. But what's happening in the brain is there is an inflammatory response. It could be from lack of sleep. It can cause brain fog. It could be just lack of exercise. It could be stress causing an inflammatory response, because when you're stressed, your adrenals are in super dry hyperdrive. It could be related to food proteins. People don't think about it just because it didn't give them diarrhea or gas or bloating. They're not thinking about foods impacting or causing inflammation and impacting their brain function. So the brain has a really intricate mechanism of being able to detox on a regular basis. But sometimes if that gets saturated and your brain cells that do that function, it can cause stress, oxidative stress, and that can cause inflammation. And then depending on where it is, your patient can have symptoms. So we talk about the concept of neuroinflammation. And neuroinflammation can look anywhere, like where patients can have intermittent brain fog, fatigue, anxiety, depression. But if in severe cases of neuroinflammation, people can have neurodegeneration, and that's so whenever you hear brain fog, you definitely want that patient to be evaluated, because that's where we talk about function, right? So there's a problem with the function. So before it becomes a disease, we want to intervene. So toxins is a big part of it. Clean air, clean water, and then if, as I said, as you're peeling the layers, and if they only go so far, and then you're wanting to look more, definitely diving deep into toxins is a big part of it.
That's good. Final question. Can pesticides be evaporated into our atmosphere and spread by rain?
Evaporated into the atmosphere, like, you mean when the spray is...
I'm imagining it like in a pool or in like a river or something, and then it goes up and,
Yes, that's true. It will get taken up into the atmosphere and then just move over and rain down somewhere else. So that's how we're getting small amounts of pesticides in organic food. but it's far less than in crops that are directly sprayed.
Is there a distilling function happening with that at all, or is it? Because wouldn't you make distilled water in a similar fashion, like
evaporation? So
I guess I don't know. I'm sorry, I don't know.
Yes, that's a good question. How is it getting up into the atmosphere? But plastics, nanoplastics, are being found at the top of very high mountains.
Really?
It's just taken up by air currents, I believe.
Okay.
By air currents.
One way or another, they're getting around.
Yeah.
Whether or not the distilling factor is.
Yeah, I think it's through air currents that they're getting up there. Okay. Yeah.
Okay.
Let's thank you both so much, and thank everybody for putting up with us.
Yeah.
The floor is yours. All the people that are here live today will know where to find you because you're right here. But all the people that are listening to this, how can they find you post listening to this show?
So my office is located in Mason,
Ohio.
Yes. I forgot your listeners are all over the place, which is nice. So my practice name is Cincinnati Functional Neurology. And I'm also the director at the Affinity Center, which is a center where we treat ADHD and mood disorders, and that is located in Blue Ash, Ohio.
Beautiful.
My website is cincinnatineurology.com. Anything else?
Do you have a social media? Anything you want to put in here?
Yeah, you can find us on Facebook, Instagram. Yes.
Right on, and it's
Cincinnati Neurology.
Right on, and then.
Foundations Wellness Coaching, which will be changing soon to just Foundations Wellness. It started as just the three of us, Jen, Lisa Schumacher, and myself, and 3 RNs who are giving that holistic care to people. But now we have added our medical team. So Dr. Contractor is our supervisor, our supervising physician, and Jamie Rui is our new nurse practitioner. So that's kind of our big announcement, that we're now not just a coaching practice, but we are an integrative practice. So
that's amazing.
We're really, really, really excited about that. And you can find us at Foundations Wellness. Coachingfornow.com, but we're going to try to get that changed.
My guess is you'll have both domains.
Maybe, yeah,
I'm sure.
Probably. You're right. And on Facebook and Instagram, and we have a store in our on our website as well. So if you want to check out our liposomal essential oil products and many of our binders and products there. Just one last word about Jamie before I forget to mention it. She became very, very ill with meningitis and did a lot of things to help, but she came to see us at Foundations and made a pretty dramatic recovery. And since then, she has felt a real calling and a passion to help others. So she's really excited to start seeing patients, and we're very excited to have her. So, yeah.
Right on.
Awesome.
Thank you so much. Yeah, that's it.
Well, thank you very much.